The Eastern Cape Department of Health has raised concerns about the number of girls under the age of 14 who gave birth between July and December last year. 319 girls, to be exact, aged between 10 and 14 have given birth in the province's hospitals. Joining me now for this worrying discussion is Clinical Services Deputy Director General in the Eastern Cape Health Department, Dr Litha Matiwane, and we're also joined by the Kula Community Development Project Program Director, Mr Petros Majola. Both the gentlemen are in the Eastern Cape. To both of you, thank you very much. Let me start with you, Dr Matiwane. The Sexual Offences Act states very clearly that the legal consenting age, sexual age that is 16. So when someone decides to engage in a sexual intercourse with a 10-year-old, that's a crime, is it not?
It definitely is, Toli. It definitely is. And that is the most worrying issue around this issue, to say that, as we have put it, children are having children. And it is something that is worrying us as the department and as communities, as parents, obviously.
Let's talk about what is being done, therefore, Dr Matiwane, before we go to Mr Majola. What is being done, yes, in your view, by government? My understanding is that there are a number of departments that have come together to try and solve this issue. What kind of solutions are you contemplating?
Thank you. The Department of Health, in partnership with the Department of Education and Social Development, have come together. We actually launched formally last year a school health program, which, as part of that school health program, the focus was also around the issues of teenage pregnancies. Now, the activities that we are looking at is to ensure that these young people who do fall pregnant, first, we try and prevent that from happening. So what we are doing is to ensure that we give them access to issues of family planning, ensuring that they can prevent falling pregnant. So what we do, we've partnered with education, and education has given us access to say we can go to schools and start to engage with learners. And we also, in our own facilities, we have what we call youth-friendly zones, which are actually ensuring that we give the youth opportunities to come. Because one of the challenges they have, it's two challenges actually. Firstly, they say that our facilities are not accessible. And secondly, when they come to our facilities, they find elderly people and then they can't engage freely. So what we are doing in the youth-friendly zones is we've got people that are peers, that is now our junior nurses, that, for example, the ones that have just done community service and so forth, who are still young, who can understand the language, who can also make the other child feel free to speak with them. But also what it does is that it gives them an opportunity to say, when they come from school, they can go to these youth-friendly zones where they can actually do their homework, be able to interact, be able to talk to people, to be able to say, I've got this problem, to a person who can understand them, and then they are able to feel free. But also, like we're saying, that Department of Education has graciously also given us an opportunity to come into their facilities. And we've got schools where we're piloting this across the province. And that also assists us to be able, with the teachers, with the social workers, because one of the areas is that we've also got social development that is also coming through, that is also going to assist us in taking through the children for psychosocial support and for ensuring that if there are other issues like statutory rape and so forth, these are dealt with immediately and as quickly as possible. But it is something that is really worrying us, and we want everybody to assist us, parents, teachers, children themselves, and their peers, to come up front and start to say there is a way of preventing this. And the one way of preventing this is to be open and talking about it, but also because it's not only the older ones that are making them pregnant, also their peers are making them pregnant. They must then, if they have to go through a process of having to do sexual intercourse, they must ensure that they do prevention and promotion, because also it doesn't also talk to that's just the pregnancy. There are also sexually transmitted infections that are also part of the problem. And we see this in some of these pregnancies, because when they come in, they have what you call chorioamnionitis, which is an infection that is caused by still having sex whilst you are this thing, and then unprotected sex and so forth. And also we are seeing that there are other issues like the challenges we have with the street abortions that are also a problem that result in some of the complications that come through. Thank you.
These are all very worrying signs, Dr. Matiwane. Let's bring in Mr. Petrus Majola. Mr. Majola, you run an organization that, I suppose, looks into this field more directly. You're based in Umtata. Perhaps before I ask you the question, let me just read you the stats as captured by the City Press newspaper this weekend. And they talk about girls aged between 10 years and 14. There are about 319 of them, all of them in this period between July and December last year. Then those that are between 15 and 19 years old, the number is even bigger there, 9,396. A person listening to this conversation is saying, well, South Africa has indeed reached its stage of moral degeneration. What is your role as an organization?
Thanks and greetings to Dr. Matiwane. Yes, it really worries, because when we look at the numbers that were released, and also considering the ages, and looking at the Sexual Offences Act, as you mentioned in your opening statement, it means that the province of the Eastern Cape is in a serious trouble. Given the fact that when a child is 10 years of age, that child cannot even use a birth control. Because if you look at the provisions of Section 134 of the Children's Act 38 of 2005, when we talk birth controls, we start from the age of 12 years and above. Now, when there are children at ages of 10, then it means that then we are in a serious trouble. But also, I always maintain my stand in saying that if we want to win the battle, I hear when Dr. Matiwane was saying the departments, it's not their baby only. Because the civil society structures have a role to play. The parents, I know that he mentioned the parent component, because parents have a role, because it is their responsibility to instill values in their children, because we cannot outsource the responsibility of saying no to our children by giving them the contraceptives. But we need to instill those values so that they know at this age, I cannot do this. In response to this or to this number list, that it would be appropriate when the department is saying of this number, so many cases have been referred to the FCS unit at SAPS for investigation. Because a child below, because remember the Amendment Sexual Offences Act, it would also talk about a bracket of 12 and 16 and be in their game, I don't know what you call it, because the child between 12 and 16, and then we say they can have a sexual relationship. But now we are talking 10 years, we're talking 11 years, we're talking 12 years. Those kids cannot have babies. Now, ours is to say, let us sit down. So because there is a confidentiality, blah, blah, blah. But I think Dr. Matiwane knows very well Section 28 of the Constitution talks about a child's best interest, which means in that case, it is the responsibility of a healthcare professional to approach the police when a 10-year-old is pregnant. Dr.
Matiwane, you earlier referred to birth control. Now, I'm not going to pretend to know whether when these children are in hospitals trying to give birth to their own babies, they are accompanied by their parents or not. You will be able to give us that. But the question I want to ask around parenting is that if and when some of them do enter the hospital facilities, those at least that are accompanied by parents, are they spoken to by health officials about birth control, and how receptive are parents to discussions like that?
It is a very difficult and challenging area, as you say, Tony, because because the issue is, you see, like Dr. Matiwane was saying, that if you categorize the children, I mean 10 to 12, those children are still below the age of consent, and therefore we are not supposed to even ourselves start to engage them on birth control and so forth. The challenge that we have is that the children come and have these challenges that they do have, and we do call in the social workers to really look at the issue of saying, can we then get in Justice Department and so forth to be engaged in this. Now, what you will not find out is that in most of these, the children actually come alone because they sometimes even hide the fact that they are pregnant from their parents. But when the parents are there, yes, the social workers, our healthcare professionals sit as a team and engage both the parent and the child in terms of ensuring that we are trying to make sure that the child understands firstly that this is something that should not have happened, and then there are ways of ensuring that this can be prevented, and also to try and expose this harm to the child. So it is a complex issue. It is a delicate issue because at the same time, like I'm saying, some of these children do not want to come up front and say who this has done. One of the challenges that we see at Matiwane is that when some of these issues you go and say to the parents, then this child has had this will need to take to the law enforcement agencies. They then say, no, we're going to deal with it as family. And this is some of the challenges, and that also, because you can't go beyond what then the family is saying, even though the law obviously says you can go straight and call the law enforcement. But with the social workers, we try and involve the family as much as possible so that it is not something that has got negative connotations for all. Thank you.
Gentlemen, I really desperately want to continue this conversation, but the line is quite terrible. So we are going to have to end this discussion there. But my promise to you is that we are going to continue it in the near future, and I am going to make sure that we drill deeper because there are clearly massive issues that are stacked against these children. This cannot be allowed to continue to happen. Mr. Majola, we are going to have to leave it there. I know you wanted to also weigh in. Unfortunately, because of this connection, the bad connection, we're going to have to try and end it there. Hopefully, we can get you next time on a better line. Dr. Litha Matiwane is the Deputy Director General in the Eastern Cape Health Department, and Mr. Petros Majola, Program Director at Kula Development Project, both of them based in the Eastern Cape. Very sad indeed that we couldn't complete this discussion.